who puts the bigger strain on our nation's healthcare system? Healthier people or sicker people? The answer might surprise you. Our health insurance system in this country is funded by a combination of private sources, such as insurance, and governmental sources, such as Medicare and Medicaid. You can't separate the two. Rising costs in one system, private or governmental, increases the cost for the other. If a doctor or hospital cannot make enough money from Medicare, what are the chances that might affect how they price their services to insured patients? So if you just think about the classic group of health insurance that covers workers during their working years, older, sicker workers definitely cost more than the younger, healthier workers. But just because an individual retires and moves off the group health plan onto the Medicare rolls doesn't mean that individual is not affecting the system as a whole. He is. Boston College's Center for Retirement Research did a fascinating study that has staggering implications for anyone planning to retire, for our healthcare system, and for our economy as a whole. Got your attention yet? Well, here's what the study found. On average, people who are sicker today are going to cost the healthcare system less than people who are well today. You heard me right. People in worse health today will, as a group, cost our healthcare system less than those who are healthier today. And that's because, as the National Institutes of Health tell us, so much of an individual's total lifetime medical expenses come during the senior years. In other words, the longer they live, the higher the cost rises. To quote the center study directly, our main finding is that although the current healthcare costs of healthy retirees are lower than those of the unhealthy, the healthy actually face higher total healthcare costs over their remaining lifetime. The expected present value of lifetime healthcare costs for a couple turning 65 in 2009, in which one or both spouses will suffer from a chronic disease, is about $220,000, including insurance premiums and the cost of nursing home care, and 5% expect to spend more than $465,000. The comparable numbers for couples free of any chronic disease right now is $260,000 and $570,000 respectively. If you're not real good at keeping up with numbers, that's a difference of between $50,000 and $100,000. So what does that mean to you, whether you're a young worker or an older retiree? Well, according to the National Center for Policy Analysis, the 2009 Social Security and Medicare Trust Report shows the combined unfunded liability of these two programs has reached nearly $107 trillion with a T dollars today. That's about 7 times the size of the U.S. economy and 10 times the size of the outstanding national debt. Change is coming no matter what the politicians say. Just ask the Greeks. Economist Robert Samuelson wrote in the Washington Post, "What we're seeing in Greece is the death spiral of the welfare state." This isn't Greece's problem alone, and that's why its crisis has rattled global stock markets and threatens the economic recovery. Virtually every advanced nation, including the United States, faces the same prospect. Aging populations have been promised huge health and retirement benefits, which the countries have not fully covered with taxes. The reckoning has arrived in Greece, but it awaits almost all wealthy societies. Author Patrick Cox puts it more bluntly. The typical medical welfare recipient is not a single mother living on food stamps. It's a retired person in a sun hat wintering in Florida or Arizona. Society could easily take care of the legitimate medical needs of disadvantaged younger people. The big overriding problem is the transfer of money from a shrinking percentage of younger workers to an increasing percentage of older retired people. There is no blanket answer that's right for everyone in light of this oncoming reality. But we all need to know change is coming. How will you deal with it? Offering you wisdom on wealth, I'm Byron Moore.